Well, hey there, it's Liz Rohr from Real World NP, and you're watching NP Practice Made Simple, the weekly videos to help save you time, frustration, and help you learn faster so you can take the best care of your patients. So today I want to talk to you about referrals and like decision making, medical decision making, and how it relates to referring. I feel like this comes up a lot with new nurse practitioners that I work with. That it came up for me when I was new, but also in the mentees that I work with and the colleagues that I have in person in real life. Um, but so the kind of scenario that I'm talking about is that a newer nurse practitioner who has either weeks or months of experience, like we graduate with the foundational knowledge and the clinical decision making skills to be able to continue to learn and grow. Um, Nobody, regardless of what program you went to or what profession you're in, knows everything or will ever know everything, right? So there's always going to be learning on the job, right? And as you go, and as you see new presentations of things, especially when they're not a textbook presentation. So the situation that I'm talking about is a lot of newer nurse practitioners. Uh, there's kind of like three main scenarios, and especially like as it relates to referring. So I actually made a video about like how to know when to refer. So definitely check that out if you haven't already. And I also made another video about how to make a plan of care. So if you haven't watched either of those, definitely check those out after this video. But really what I'm talking about is when the context is that you're in clinic, you have to see a patient, you're going in to see a patient, you have maybe 2 or 3 waiting. You have 10 to see in a day. You have charts to finish from the day before. You have tasks sitting in your inbox right now of things that are sent to you today, either by phone calls, medication refills, the front desk needs you, the pharmacy needs you, the lab needs you, right? Like I'm not trying to stress you out, but that's like the main situation, right? So this is the context. So you're seeing a patient, they have a chief complaint, possibly of a red eye, right? I mean, I had a hard time picking one. I just came up with red eye. I don't have a succinct situation to share with you, but I'm just going to improvise. So if you have a chief complaint in front of you, someone has a red eye, and we've learned the foundations about that, right? But one of the things, I'm just going to throw some pearls in here throughout this whole video. One of the things about whenever you see a patient, even if you learn the foundational knowledge, for me, and I find this with a lot of other clinicians as well, I'm going to remember like the most important stuff, right? And I'm going to file that away, but I'm also going to look things up to refresh my memory, right? Because I'm not a walking textbook. I know a lot of stuff, but that is the case for most people, right? Especially to make sure that things haven't changed, right? There aren't updated guidelines or recommendations, like, et cetera, et cetera. And this is especially true for newer nurse practitioners because you're still building your arsenal of knowledge and you're still building on the patients that you've seen, right? And the types of presentations that have come up. And still at 5 years in, I see things that I've never seen before, right? So anyway, so the context is that you have somebody in front of you with, you're fairly familiar, right? With, a red eye. I'm able to talk about myself. I'm pretty familiar with a red eye, but you know what? I just want to make sure I've asked all the history questions and all the physical exams that I need to do and like figured out what are those worst case scenarios, right? So you kind of have like 3 options. So one, and I talk about this in how to make a plan of care. I usually excuse myself if I have to like do some reading and investigation. I have no affiliation with UpToDate, but that is what my main go-to resource. And so I will, kind of look on UpToDate, figure all that information out, take some time to do a little bit of a deeper dive on that particular topic. Just to either refresh or even if it's a brand new thing that you haven't seen before, right? Because we all have those, right? Doing a deep dive on there versus in that same context of the chaos of clinic life. And it's especially a presentation that's not even matching up with the things that you've kind of done the work yourself in terms of looking things up. And you're not quite exactly sure what you should do, which is the safest option, like where, what to go next. You can ask. Scenario 1 is like you do the deep dive, you feel confident with what you have found, you're basing it off your clinical judgment, your foundations of knowledge, the patient experience you have, versus, I really want to ask someone just to be sure, or I need some help because I am up to my eyeballs right now that I need some more help. I need a little bit of a shortcut here, especially as it relates to the non-textbook, quote unquote, presentations that involve off-book clinical judgment, right? Option 3 is choosing when to, if they need a referral or not. So do you make the plan of care yourself, or do you decide the treatment yourself, or do you feel like they need a further referral? So I want to pause here and say that a lot of newer nurse practitioners that I work with have a big concern about this, right? We're all very concerned about utilizing medical resources in the best way possible. Not over ordering tests, not over referring, not ordering too many medications, like things like that. And so there's a really big concern about when should I refer, which also reminds me, I have a video about that. If you haven't watched that already, definitely check it out. My top tip for figuring out if you should refer somebody. However, I want to just pause here and do some normalizing. I hope this whole video is normalizing for your lived experience as a nurse practitioner or soon to be a nurse practitioner experience. But me personally, I don't have any judgments about referrals. My main judgment, if I have one, is are you giving safe care? And that's kind of the moral of the story of what I'm pointing towards here, is that despite whatever avenue you take, the best thing is the safest thing, right? And you might aspire, as it comes to referrals, there is a style, there are guidelines, there is the quote, there are wrong things to do, there are harmful things to do, but also within the guidelines of what's recommended, there's stylistic choices, right? So and I think that's one of the other things that people adjust to as they're newer in practice of there's one right way to do things, but spoiler alert, there isn't necessarily one right way. There's a wrong way. Definitely there's a wrong way. But in terms of the right ways, there's multiple ways to do it. So as it relates to referrals in particular, my personal perspective and paradigm of practice and desire is that I'm going to maximize my scope in primary care, especially in the context of taking care of patients who don't necessarily have the resources that maybe some other patients do, or they don't have insurance or something like that, right? So I'm going to try to do the best that I can for them to keep them in-house with all of that before referring. But other clinicians with as much or more experience than me, physicians, nurse practitioners, and physician assistants have a different perspective where they are more likely to refer earlier on. And I just really believe that there's a spectrum here, because I think that there's a little bit of a conversation about that. And there's a lot of worry about that of am I referring too much, right? But again, moral of the story is what are we working with here, right? And I think one other thing I want to mention about that in terms of those avenues of decision-making, right? If you're doing the deep dive route and you feel confident making that decision that you're doing the safest care possible right now, absolutely amazing, right? Or if you feel like you wanted to ask somebody, or if you did that and asked somebody and you referred them, that's fine too. All of these are fine, right? But also for me personally, when I was a newer grad, I read constantly. I came in early, I stayed late, I was reading on the weekends, and the evenings at night. I constantly worked, right? My brain physically hurt because I couldn't read anymore because my brain physically hurt. And I still remember that feeling in my brain. And I get it sometimes when I'm reading about medical things, right? Because I still read all the time because that's what our job is. But I think I just want to normalize that there's an experience that a lot of people have where they have this list of all the things that I should know about already. And coming back to patient safety, what's most important is knowing about what you're dealing with right now, right? And there are foundational aspects. So if you're oh, I should really know about CKD, yeah, let's go home and read about CKD because that influences your patients, all of your patients with CKD, right? But there's someday and then there's today, right? Of exactly what you're looking at and working within those confines, right? And always coming back to what is the safest possible care for this patient, keeping in mind, work-life balance, patient safety, all of those things, right? So I don't know, this maybe I'm just going off on this video, but I feel this situation comes up a lot for newer nurse practitioners. So again, if you want further information, actually 3 video recommendations. 1 is how to make a plan of care. I'll link to all of these down below. 2 is how to know when to refer, which more clarification on that. And my favorite tool. And number 3 is the, how to ask questions in the most productive way possible. I won't give away too much in that. Just check that video out, definitely, because you'll get a sneak preview or view of what I used to be like. I was a little bit of a mess when I was a new grad. So anyway, hopefully that will be helpful. But But yeah, please let me know what questions you have. And if you haven't grabbed the Ultimate Resource Guide for the new NP, head over to realworldnp.com/guide. You'll get these videos sent straight to your inbox every week, sometimes every other week when I'm working on some big stuff in the background. I'm working on hiring some people, so there's that going on. Yeah, so these videos straight to your inbox every week or every other week. Patient stories, insights, and other just bonus content that I really just don't share anywhere else. Thank you so very much for watching. Hang in there, and I'll see you soon.